Hello everyone, and welcome to this new episode of Ask Stago, the podcast from Stago. This platform is dedicated to answer the questions that you may have about our products or hemostasis in general. My name is Lisa Gannon and I'm a product line manager here at Stago, and I'm really glad to join you for this episode. To animate today's session, I'm joined by Anne-Cécile Ortega, product line manager. Hi Anne-Cécile.
Hello everyone.
So today we'll discuss a really specialised topic, microvesicles. So we'll cover the basics, that is, what exactly are they, and indeed, what is their clinical utility in practice?
Yes, Lisa. And to cover the topic with us, we are glad to welcome Karine Carrière. Hi, Karine.
Hello.
Karine, you are product line manager at Global Marketing at Stago, and one of your product line is microvesicles. So for you, there will be no problem explaining us further what are the microvesicles.
So, Karine, let's start with the basics. Can you tell us what are microvesicles?
Microvesicles are the most well-known extracellular vesicles, but there are many more types of extracellular vesicles like exosomes or apoptotic bodies. Extracellular vesicles are classified on the basis of their size, formation, and release mechanism. Microvesicles, previously named microparticles, are medium extracellular vesicles released by activated and apoptotic cells by cell surface membrane bubbling. Their size ranges from 100 to 1000 nanometers in diameter. Microvesicles lack a nucleus and contain a membrane skeleton. They are diverse depending on their biogenesis and parent cells and are considered as molecular signature of the cell from which they originate.
And what about their cell origin?
Well, in fact, circulating microvesicles are principally of platelet origin, but they can also derive from red blood cells, white blood cells, and endothelial cells. Microvesicles express antigens originating from their parent cells, allowing for determination of the cell origin by the use of specifically labeled antibodies.
Okay, so it seems that microvesicles are small entities derived principally from platelets. But why are they so important for our field in hemostasis?
Microvesicles has been described as procoagulant entities since their first report by Peter Wlth in 1967. This procoagulant activity relies to the presence of negative procoagulant phospholipids, mainly phosphatidylserine, they can carry at their surface on the external leaflet of the membrane. In addition, the presence of tissue factor on subsets of microvesicles also significantly contribute to their procoagulant activity. A surface area unit of platelet microvesicles has approximately 50 to 100-fold higher procoagulant properties versus an identical surface area unit of activated platelet. So the role of microvesicles in coagulation activation is well accepted. Overproduction of microvesicles have been related to various physiological and pathophysiological conditions.
So we can say that microvesicles are small vesicles, but with a large clinical relevance?
Yes, Anne-Cécile, you are perfectly right. Microvesicles are playing a role in blood coagulation, inflammation, cell activation, and cancer metastasis. Thrombosis is a second cause of death associated with cancer, and microvesicles have been studied a lot in cancer pathologies. It has been shown that the level of microvesicles in the plasma of patients with gastric cancer or prostate cancer are correlated to the outcome. Tumoral cells can also generate microvesicles bearing tissue factor by themselves, leading to the initiation of cascade coagulation, platelet activation, and so at the end to thrombosis. So correlation have been shown between levels of microvesicles bearing tissue factors and coagulation markers.
So it's clear that microvesicles play a huge role in coagulation. Can you now tell us a little bit more about microvesicles bearing tissue factor?
Tissue factor is a transmembrane glycoprotein that acts as a primary activator of blood coagulation in vivo by binding to factor 7A with subsequent limited proteolysis of factor 9 and factor 10, leading to thrombin generation. Under normal physiological conditions, no significant level of microvesicles bearing tissue factor are typically detected. However, under pathological conditions, elevated plasma level of MVTF activity have been shown in patients with different pathological conditions, such as certain cancer type, sepsis, and arterial, along with venous thromboembolic disease.
And is it possible to analyze microvesicles? What are the main challenges?
Well, the main challenge is really the preparation of the sample. There are some pre-analytical recommendations in the measurement of microvesicles to avoid ex vivo microvesicle generation and to obtain complete removal of platelets prior to enable storage.
Okay, so pre-analytical conditions seem to represent an important source of variability and potential artifacts in the analysis of microvesicles. Can you tell us then how they can be analysed?
Well, in fact, there are two complementary methods to analyze microvesicles: quantitative tests and functional tests. First, quantitative tests with flow cytometry reagents, for example, to count microvesicles and determine their cellular origin. Because microvesicles are so small, their analysis pushes a flow cytometry instrument to their optical sensitivity limits. It is necessary to have tools and reagents to allow a great precision of microvesicles count to at least standardize all cytometer models to ensure good intrinsic performances of the cytometer in the microvesicle analysis. And second, with functional tests, which is the second method to analyze microvesicles, we can assess procoagulant properties of the microvesicles resulting from the action of procoagulant phospholipids and or tissue factor. Various methods can be used as, for example, thrombin generation to measure thrombin generated solely by phospholipids bearing microvesicles, or tissue factor bearing microvesicles. Or you can also use clotting-based assay for the determination of procoagulant phospholipids-dependent activity of mainly platelet microvesicles or tissue factor-dependent procoagulant activity of microvesicles.
And what about the standardization?
Well, in fact, to improve standardization of studies measuring tissue factor microvesicles, the International Society of Thrombosis and Hemostasis, the ISTH, has published international guidelines in 2019 based on the careful review of current and historical peer-reviewed publications. Minimally, the ISTH guideline recommends: first, the use of kinetic determination of MVTF-dependent factor 10A generation. Second, the use of anti-TF antibody to inhibit tissue factor coagulant activity and to ensure optimal assay specificity. And third, the use of a tissue factor calibrator to standardize procoagulant activity measurement. Reliable and accurate measurement of tissue factor expression or its activity in cells and microvesicles is really a prerequisite to explore the role of tissue factor in normal hemostasis in various conditions, thromboembolic disease in particular.
Wow, so thank you, Karine, for this conclusion and indeed for joining us for a most informative discussion. I, for one, am so pleased to learn a little bit more about this topic, and I'm sure our listeners will feel the same. And thank you to our listeners for joining us for another episode. And as usual, all literature sources and links to previous podcasts are listed in the podcast description box. And please do feel free to send us any questions that you may have to our email address, which is ask@stago.com. And we'll be really happy to address any questions in our following episodes. So, see you next time.
This podcast is brought to you by Stago. Diagnostics is in our blood.